Welcome to the IHH for Veteran weekly live stream. Here at IHH for Veteran, we specialize in assisting veterans with their physical and mental health transformation. This group addresses the unique challenges of veterans to improve their overall quality of life. Many veterans have expressed they have questions regarding cannabis and PTSD. The live stream this evening will be discussing 3 new studies on cannabis and PTSD presented in Project CBD and written by Nate Zelserich. Cannabis helps PTSD patients sleep better. In recent years, psilocybin and MDMA have been explored as potential treatments for PTSD, but sometimes more quietly, so has cannabis. In fact, according to a few quick searches of PubMed, cannabis has a longer and richer association with PTSD in the scientific literature than any psychedelic. Though you wouldn't know that by reading the headlines, setting aside for a minute how effective psychedelics may or may not be as breakthrough treatments for PTSD. There's no doubt that cannabis is still much easier for most patients to access. Recent research, including 3 new studies from 3 different countries, suggests that growing numbers of PTSD sufferers are medicating with cannabis and truly finding it helpful. Depression drives cannabis use. First, a paper in the Journal of BMC Psychiatry from researchers based in Ontario, Canada, provides some insight into cannabis use among PTSD patients during the first wave of the coronavirus pandemic. Between April 3rd and June 24th of 2020, 462 individuals with self-reported PTSD completed an online questionnaire that assessed mental health symptoms and cannabis intake both before the pandemic and in the 7 days prior to filling out the survey. Worsening depression during the pandemic led to greater cannabis use. Stress, anxiety, and depression worsened across the board. By categorizing participants according to cannabis use patterns, not using, using less, using the same, or using more, the researchers discovered something interesting. PTSD sufferers who increased their cannabis use during the pandemic were more likely to also experience meaningful perceived worsening of depression symptoms, the authors write. Does this mean that cannabis exacerbated depression? It's theoretically possible, given that the study does not address causality. However, much more likely, given what previous research has shown about the relationship between cannabis and depression, is that it went the other way. Worsening depression led to greater cannabis use. In other words, these individuals were likely suffering during the pandemic and using cannabis to make themselves feel better. The extent to which cannabis actually helped, if at all, is beyond the scope of this research, but another research study with a slightly different design tackles that question more directly. Cannabis may improve quality of life in PTSD patients. In the UK, individuals diagnosed with PTSD can be prescribed medical cannabis, yet a paucity of clinical evidence limits its use, writes the London-based authors of a December 2022 paper in the journal Expert Review of Neurotherapeutics. So they designed a study that would use patient responses to validate questionnaires to measure changes in sleep quality, anxiety, and PTSD specific symptoms. By comparing scores from 144 PTSD patients at baseline and 1, 3, and 6 months after initiating medical cannabis use, the researchers observed significant improvements in all 3 categories across all follow-up periods. Adverse effects related to cannabis use were predominantly mild or moderate, with insomnia and fatigue being most common at 20 incidents each. This study also has numerous limitations. It is observational in nature, leaving many variables uncontrolled and others, including dose size and frequencies, relevant to participant reporting. In addition, all outcome measures are subjective. Nevertheless, the study can serve to inform future randomized placebo-controlled trials with the aim of confirming these promising efforts while informing current clinical practice. Further work should also focus on including objective measures, determining optimal dosages, and conducting comparisons to exist treatments to better inform prescribing of add-on or sole medical cannabis therapy. Medical cannabis helps PTSD patients sleep better. Improved sleep quality may be an important mechanism through which cannabis reduces PTSD symptoms during daytime and nighttime alike. The Israel-based authors of a patient published in December 2022 issue of the Journal of Anxiety Disorders. To learn more about how cannabis use affects sleep, they asked 77 licensed medical cannabis patients suffering from PTSD to report each morning on the timing of cannabis use the previous evening and subsequent sleep disturbances during the night. The closer to bedtime an individual used cannabis, the less likely they were to experience nightmares. Increasingly, the closer to bedtime an individual used cannabis, the less likely they were to experience nightmares, which may in turn translate to reduced daytime stress. In a small study that again lacks control and relies on self-reporting, yet it adds to a growing body of clinical and preclinical research suggesting beneficial aspects of cannabis for post-traumatic stress disorder, in this case via improved sleep. As the authors put it in concluding their own paper, given the high comorbidity of PTSD symptoms and sleep disturbances, and the potential for medical cannabis to have effects on both, a greater understanding of how patients experience the effects of medical cannabis on overall PTSD symptoms and sleep disturbances is warranted. For a personal consultation to review your individual needs, head to my website, veteransvictory.org, and schedule your complimentary 15-minute appointment. Thank you and good afternoon.